Adherence to medication is a cornerstone of effective treatment for chronic and acute illnesses. When patients take their medicines as prescribed, they maximize their health outcomes and reduce the risks of complications or hospitalizations. Unfortunately, many individuals struggle with consistent medication use due to forgetfulness, side effects, or misunderstanding about prescriptions, while some resort to self-medication and abuse of over-the-counter drugs. Responsible medication use requires patients to communicate openly with healthcare providers, follow dosing instructions, and report any adverse effects promptly. Pharmacists and doctors play a vital role in educating and supporting patients, ensuring clarity in instruction and fostering trust. Improved adherence not only benefits individual patients, but also help curb healthcare costs globally. Today, we're beaming our spotlight on the importance of responsible medication use. I'm Lydia Samson. The first report by Theresa Shormon takes a look at common drugs abuse in Nigeria, the side effects and dangers. It explores why drug abuse remains a pervasive and growing challenge in Nigeria, x-raying how it is impacting individuals, families, and the society at large. Do you know that overdose of paracetamol, a commonly used pain reliever, can cause fatal liver failure? Theresa, we learned you also got suggestions on how addressing the crisis requires both robust law enforcement and accessible mental health support. It's over to you, Theresa.
Across towns and villages in Nigeria, walking into a chemist and asking for anti-malaria, antibiotics, or painkiller drugs without a doctor's note is almost second nature to many. But health professionals explain that what feels like a quick relief could often lead to a quiet harm. They insist that taking medication without medical supervision can result in serious health issues ranging from liver or kidney damage to outright addiction. Some patients develop resistance to life-saving drugs like antibiotics.
And once there's antibiotics resistance, it's a public health issue. It doesn't affect only the individual, it can affect others. And then there's this increased burden on healthcare system, where once the condition deteriorates, the patients eventually come back to the hospital, and then it increases healthcare burden on this established healthcare facilities.
Antibiotics, to say, of course, we know that most of our regular antibiotics are no longer working because of what we call polypharmacy. People continue to prescribe drugs for themselves, especially these antibiotics. And these antibiotics form what we call resistant. They no longer respond to the drugs. They develop resistance to these drugs because it has been abused over time. You have a little fever, you went on and get ampicillin or ampiclox. What do you expect? By the time when you have the reinfection, when you have real serious issues that should be attacked by ampicillin or ampiclox, you find out that the body or maybe the virus have already developed resistance to that or bacteria to that particular drugs.
Make sure that the antibiotic you're using was prescribed by a physician, because what happens is that once these organisms gain resistance to antibiotics, it therefore means that we don't even have drugs to use when the problem really arises.
These complications are real. They usually present several allergic reactions, internal bleeding, heart complications, mental confusion, or depression, even death in extreme cases. Yet, many Nigerians are unaware of these dangers.
Paracetamol is metabolized by the liver, and it is surprising how people call it common paracetamol. They don't know it is very deadly. There's every possibility of liver toxicity. Yes, so when there is a paracetamol overdose, there's a serious consequence which can lead to even death.
Psychiatric issues on the rise now, especially in young people, especially because there is excessive abuse of some of these common drugs for pain. For instance, codeine. The young people because it has the hallucinating effects, and by the time they self-medicate, over-abuse it, it leads to serious challenges.
You prolong the time to diagnosis of the main disease, which means that a disease that would have been picked early will be picked later because you have done quite some time of self-medication. That's one of the major drawbacks. Another drawback is that every drug we take has side effects. So if you overtake certain pain medications or you take them for too long, then the side effects of that medication begins to come into play. And one of the major or the most feared side effect of this medication is destruction of the organ of the body. The liver, the kidney, different organs like that can get destroyed from indiscriminate and inappropriate use of medication.
NTA News crew sampled opinions on the streets of Abuja to find out why people prefer self-medication rather than seeing a physician.
Those people that use self-medication, some because of ignorance, some because of negligence, some the availability of some quack healthcare providers that makes the medication available on counter. So the availability really, actually.
Some people use it because of ignorance. Some, they use it because they have become addicted to it. Some, they use it because they are looking for a cheaper way. You understand? They are afraid of going to hospital. If they're running away from the expenses of buying card and other things. So they will decide to go and buy drugs in the chemist or by the roadside and take.
Probably they're not well informed, and some of them coming to the hospital, the queue at the hospital is sometimes long, so they might want to self-medicate.
Some of them, they might not have the resources to get the drugs they're supposed to get, so maybe they try to go for cheaper brands and things like that.
You know, it's somehow cheaper. Just go to the pharmacy, they just count drugs and just give you. But if you want to come here now, you have to come in the morning. In fact, spend nearly the whole day. See doctor, from doctor they will tell you to go for test, from test you come back the next day for the result. So all that, people don't have time, they try to avoid it.
People feel the experience they have for somebody. Like maybe they have heard it about somebody is having headache and they decided to go and take a paracetamol, PCM, for an easy calm of the headache.
Okay, so I'm giving you amlodipine, atorvastatin, and valsartan. So this for this one, you take it preferably every night, 1 tablet at night. Okay. Then this one, you take once in the morning, one tablet in the morning as well. So that's your routine drug.
And you said that will come next month.
Yes, you come back once, like I said, this is what we have. So when you come back next month, we'll give you.
Expert warns that lack of proper awareness, poor regulation of over-the-counter sales, and the fear of medical bills are pushing more people into an unwholesome and dangerous habit.
If there is a way to educate the public or make them aware of the consequences of this medication, of self-medicating, it will really go a long way. So educating them brings them to the facilities, brings them to professionals to get the appropriate drugs they need for their condition. And once they are in the right facilities, they will get the appropriate counseling they need on how to take this medication and how it is going to affect their life.
Doctors, however, insist that getting tested and receiving the right prescription is always the safer route.
Unfortunately, a lot of us at one point or the other will indulge in self-medication. So for example, you say, oh, I have fever. The next thing they will say is it's malaria, and they go and buy anti-malaria and take. Unfortunately, fever is a symptom for so many diseases. It's not only malaria. So the advice is, before you take an anti-malaria, at least do a malaria test and let it say malaria positive. Then you are sure. Another major side effect, for example, as I was talking about the malaria medication, is something called resistance. So if you keep taking the medication when you don't need it, when the need actually arises, there's immunity. So the mosquitoes have gained immunity to malaria drugs. So you find out that you are taking the medication and it doesn't seem to be working. So that's another major drawback of self-medication.
My advice is that when you have a challenge, you have a serious you need medical attention, you need to present at a very good facility. Present before your doctor. Nigeria has this habit of not going to the hospital until it has now gotten to a stage where they can no longer manage it, or maybe they can no longer withstand it. It shouldn't be so. You have a challenge, you have a pain anywhere, you first of all present to the hospital. So my advice is that for people who self-medicate, it is better for you to present, because to treat renal dysfunction or to treat chronic kidney disease is the worst. For you to go to the hospital, pay the little money and see the doctor, you get the right medication, rather than for you over time at the long run to be battling with kidney disease.
A doctor who spoke to us insists patients must seek medical advice before taking any drugs. He also says they must read the label, know the dosage, and above all, stay away from self-medication.
Self-medication is a serious challenge in our society. My advice is to have a proper health-seeking behavior among us, and this requires some level of sensitization. People should be able to wake up, go to the hospital when they have any challenge, and seek for proper healthcare behavior. By so doing, we should be able to eradicate some of these self-medicated drugs, and some of these over challenges that we have, it should be reduced over time.
These experts also advise that the next time anyone feels tempted to self-treatment, they should pause, as one wrong pill could cause more harm than the illness itself.
The next report by Thomas Ogbetere is providing clarity on why responsible medication use is crucial for ensuring effective healthcare outcomes and safeguarding public health. He has an overview of the World Health Organization estimates that shows over half of all medicines worldwide are improperly prescribed, dispensed, or used, leading to serious issues such as wasted resources, adverse drug reactions, ongoing health problems, and other ripple implications. Let's get all the details from Thomas.
Responsible medication use, according to Dr. Abdullahi Aminu, a consultant family physician at the Habib Medical Clinic and other experts, is a vital component of effective healthcare, and its importance cannot be overstated, as many abuse and misuse can lead to dire consequences. Worried about ensuring responsible medication use, the World Health Organization came out with a report of how over half of all medicine worldwide are improperly prescribed, dispensed, or used, leading to various issues such as wasted resources, adverse drug reaction, and diverse ongoing health problems.
They say they know themselves, so they abuse the intake of analgesics, they abuse the intake of antibiotics, they abuse the intake of anti-malaria, most especially. Anti-malarias are overused now, and antibiotics, and they also don't adhere strictly to the way it is supposed to be, compliance. They don't comply, they don't complete their medication.
And it is an event that occurs when a patient or an individual gets a drug that is not appropriate for his or her clinical needs, or it is not at a dose that is required for his or her clinical needs. That is an inappropriate medication. And I've seen quite a lot of them, in the course of my practice. For instance, the use of antibiotics when there is no need for it. An example is when people come down with common cold, which is a viral infection, and it's self-limiting. A lot of people go to get an antibiotic to use it. It is not necessary.
Instance where a patient self-prescribes medication. So you're having headaches and you just feel you have malaria, and you go and take anti-malaria without a proper test being done. Or for instance, you skip doses of your medications. The doctor have said take it 3 times a day, you decide to take it once a day. So all these terms fall under irresponsible use of medication.
And the first and foremost is taking larger than the dose that was prescribed and dispensed, prescribed by the doctor and dispensed by the pharmacist. Maybe you tell the patient take 1 tablet morning and evening for 3 days. We've had series of cases where a patient we say instead of taking 1 tablet morning and evening, we take the 2 tablets at once. I've seen it in my practice. So I think number one is that.
An interview with medical professionals re-emphasized that responsible medication use requires a collaboration between the healthcare providers, patients, and policymakers. The expert agreed that informed healthcare professionals who correctly diagnose conditions, prescribe appropriately, and educate patients about their treatment remain crucial to promoting responsible medication use. Patients also must adhere to prescriptions and understand their medication to avoid self-medication, misuse, or underuse.
Providers, prescribe based on your ethics. You are a professional. You are guided by your ethics. You are guided by certain kind of conduct. You are told, don't give anybody any medication unless he needs it. And how do you give him? You give him according to what the ethics, what also the policy has said, by age, by weight, by all these things. What is the problem? So that's what you should do as a provider. You have that moral obligation to be guided by your ethics and make sure that what you are prescribing is correctly, ethically all right for that patient.
That inappropriate use of medication stems from a lot of factors: inappropriate diagnosis, inappropriate prescribing, inappropriate dispensing, inappropriate administration, and inappropriate patient compliance. Those are factors. Healthcare delivery is a teamwork, and every section or member of the team plays a significant role. The patient is usually at the top, because everything is centered around the patient. So if there is a wrong diagnosis, for instance, the doctor is going to work based on that wrong diagnosis and prescribe a wrong drug for the patient. And the wrong drug is going to be dispensed and is going to be administered. And then you find out that the disease, that the clinical symptoms and features the patient was having is still persistent. And then you see that they send the patient back again and they find out that, that first diagnosis was wrong. It was from that first step that every other thing followed and came out to be inappropriate.
Also, some of this fault is on the side of the healthcare professionals. So you find that sometimes, mistakenly, we can prescribe a medication wrong dose. That's on the part of the healthcare. But how do we mitigate that? Collaborative effort. So we should ideally be working with the pharmacist, even the nurses. So the pharmacist will tell you, this drug you have sent, the dose is not appropriate or is not adequate, and can make corrections. So we should learn to work together, collaborate in the health sector.
It is a dispensing error. There are some cases where there is a prescription error made by the doctor. There are some cases where there is a dispensing error by the pharmacist. And even a nurse can make a mistake. That's why we have these check and balances.
To deepen and promote responsible medication use, experts advocate for interventions such as council guidelines, public education, continuous medical training, independent drug information, and effective regulation. These interventions, according to them, will help ensure that patients receive the right medication at the right dose and duration, tailored to their specific clinical and medical needs, and at the lowest and affordable possible cost to individuals and the community.
Drugs has to be prescribed to patients before the patients will take, and drugs have to be taken the way it is prescribed by them, and they are going to be informed on how to take the drugs, what are the side effects, adverse effects, what to do when it happened, and there will be need for them to adhere to the prescription.
I've also seen instances of underdose. I see a lot of times people say they have an infection, they go to buy 2 capsules or 1 sachet of Ampiclox, and they just take for 1 day or 2 days and they stop. You know, some people take just one capsule and they think that is enough. That's an underdose. It's an inappropriate use of an antibiotic. I've seen overdose of an antibiotic also. You know, some people even feel like, well, when they are involved in casual sex, you know, the way to prevent infection is to go and swallow large pills of antibiotics. Someone had approached me to take, 8 capsules of Ampiclox before because he just got involved in something. And that is also an inappropriate use of an antibiotic. And that is very deadly because there is toxicity that is associated with such activities.
When we work together, as I had mentioned before, it makes mistakes to be less. Everybody knows what their place is. The patient knows that if I don't use the drug at this time, there's going to be a problem. The patient knows the side effects that could result. Now, the healthcare professional have access to information now, online, colleagues, discussions, having meetings where these issues are discussed. So it's not about just having a mistake and just sweeping it under the carpet. Discuss it so that it doesn't repeat itself. And then for the policy makers, we have to first of all even bring it to their attention so that it's seen as a problem, because it's actually a problem now, especially with this resistance that we keep talking about. We're having antibiotic resistance, we're having anti-malaria resistance. If we keep doing that, most of our drugs will become resistant and not effective anymore.
Medical experts also say irrational and inconsistent medication use, including polypharmacy, self-medication, can have serious consequences, including treatment failures, drug resistance, and increased health costs. They agree that patients' education plays a crucial role in promoting responsible medication use, and healthcare providers must effectively educate patients about their treatment to prevent misuse and misunderstanding.
We have to start with a comprehensive patient assessment, review of the patient's history, drug history of the patient. Does he have allergy? Is he on medication? What medication? Is he not well? What drugs is he taking? These are the comprehensive review of the patients first. That's where you check. Current medication, what is he taking? What is he taking now? And then the use of, clinical guidelines, you use the pharmacy also. They will give you all these things. Electronic presentation, prescription tools, follow-up regular to ensure that effectiveness is ensured.
They opined that collaboration between healthcare providers, patients, and policymakers is essential to ensure that medicines are used responsibly and effectively. This collaboration, they noted, will help optimize health outcomes, prevent harm, conserve healthcare resources, and support sustainable healthcare system globally.
It has to be clearly spelled out to the patient. Patient has to be informed, has to be involved, have to be educated, and there should be a good prescription policy. There should be no polypharmacy. There should not be any ambiguity in the prescription, and there should be regulation, a good regulation about prescription. Patients should be discouraged from going to the counter to take medications. Patients should always go to the physician or the pharmacy to take medication, and it should be explained very clearly to them.
Also, there are instances of polypharmacy. Polypharmacy is when people use too many drugs together. One of the dangers of polypharmacy is that it can cause an adverse drug reaction. In fact, it's one of the leading causes of adverse drug reactions. And what is adverse drug reaction? It is an unwanted or a noxious event, that occurs when someone takes a drug at a dose that is normal, a dose that is used for treatment, for prophylaxis, for diagnosis and prevention of diseases at a normal dose, and then there is an unwanted reaction to it. A lot of times it comes up as a result of interaction between drugs that people take.
The experts are unanimous that responsible medication use is a crucial aspect of effective healthcare that requires a collaborative effort. They are on the same page that by promoting responsible medication use, society can optimize health outcomes and support sustainable health systems. Therefore, it is time to take action and ensure that medicines are used responsibly to fulfill their intended role of providing healing, saving lives, and effectively ensuring patient safety.
Sure, we all are better informed. Self-medication and over-the-counter drug abuse pose serious health risks. Experts are categorical that improper use can cause dangerous side effects, misdiagnosis, and addiction. Without professional guidance, seemingly minor symptoms may mask major illnesses, delaying vital treatment with risks of fatality. For safety, always consult a healthcare provider before taking any medication. Don't forget, responsible drug use saves lives. Thanks for watching. I'm Lydia Samson.